and welcome. You're watching NewsX. I am Meenakshi Upreti. Now, it was World Brain Health Day, a day which many of us don't know much about. To begin with, do we even need to know about a day like this? Why is brain health so pertinent? Are there any diseases, any neurological brain diseases which can be reversed? What are the major diseases which we must be aware of? Advocacy, of course, the need of the hour. But why need it? To discuss all of this and more, I'm being joined by a panel of experts, most of them, of course, top neurologists of the country, starting, of course, with Dr. P.N. Ranjan. He's a senior consultant neurology at the Indraprastha Apollo Hospitals in the national capital. Dr. Sahil Kohli, senior consultant neurology at Max Hospital. Also joining us is Dr. Kunal Behrani. He is the director of neurology at the Fortis Escorts Hospital. And Dr. Manjari Tripathi, she is a senior professor neurology at the AIMS, New Delhi. I'm going to start first of all with you, Dr. Ranjan. World Brain Health Day. Why should we even know about this day? Because a lot of people may ask, why is it pertinent? In a post-COVID, in a post-pandemic era, would you say the significance of a day like this even more, sir?
Absolutely. Good morning, everybody. I think it's high time we started talking more about the brain. And obviously the awareness of brain and the awareness of brain diseases has been increasing over a period of time. I remember 10, 15 years ago, we used to never talk about stroke. Then we started talking about the World Stroke Day. And today, World Stroke Day is celebrated all over the country, all over the world to make people aware that stroke is a preventable and treatable catastrophe. In the same thing here, you should know about your brain, how to treat your brain. If you look after your brain, you can treat a large number of neurological disorders. Now you can look after people who develop a progressive memory loss. You can prevent a stroke. You can treat demyelinating diseases. Hence, it is becoming very important for us and everybody else to know that brain disorders are not only preventable, but they are treatable.
Yes, and that's a very pertinent point which you raised, sir. Preventable and treatable. That's why perhaps, say, Dr. Behrani, if you could come in here, advocacy and awareness, the need of VR, because when it comes to, brain diseases, and if you ask a common man, maybe they can mention, say, as Dr. Ranjan mentioned, say, a stroke or epilepsy, but nothing really beyond that, not much awareness around the same.
So rightly said, so in last 10, 15 years, I would say in last 1 decade, we have changed a lot of changes in the management of strokes and other non-communicable diseases. So likely said, initially people were not very aware of these strokes, epilepsy. Nowadays, because of thanks to our Academy of Neurology societies, so people are getting more and more awareness about these diseases. Not only because they are knowing more about the disease, also over a time we have developed a lot of treatment options are there now. So there are a lot of treatment options in the field of strokes, in the field of epilepsy. Day by day, new treatment regime are there, new treatment options are there. There are medicines which were not there in the past. Now we are using very frequently on our everyday practice. And most important, as always been said, prevention is better than cure. So we should try and target to prevent these non-communicable diseases, these diseases which are really toll for the patient, for their relatives, and always seek attention and try to get rid of some common risk factors which causes these diseases like strokes. And with this World Brain Week and Day, we try to make awareness about the risk factors which can lead to such diseases, and we can prevent those diseases also.
And, Dr. Kohli, since we are speaking about brain disorders, and I know if I ask you to elucidate all of them, it would take a large and a long amount of time. But if you could just take us through the major brain disorders which one must be aware of, and especially the preventable ones, sir.
So very good morning to everybody. Yes, as has been rightly pointed out by the panelists, that neurological disorders have a huge spectrum. But the awareness needs to be more. It has increased over the last decade and a half. but it needs to be more. Suppose we talk about stroke. Earlier, when I was doing my medicine MD, the stroke used to be not treatable. Whenever stroke used to come, used to say, okay, just take this medication, now treat it. But now the awareness is increased. The stroke is treatable within 4.5 hours window, and even after that, if mechanical thrombectomy can be done. So the good thing about stroke and other cardiovascular diseases is that 80% of the strokes can be prevented if we pay attention to hypertension, if we pay attention to diabetes, if we pay attention to lifestyle, if we pay attention to our quit smoking, stop taking alcohol. All these things like stroke with control of risk factors can be prevented. Similarly, we talk about epilepsy. So epilepsy has been a long stigma in our society, but all those patients who have epilepsy and they remain compliant to medications, have regular checkups, they can live a normal life. So that needs to be brought more in notice, and people should comply with the medication. Similarly, when we talk about headaches like migraines, most of them are lifestyle diseases. Most of the times you see the youngsters sitting on the computer 10 hours, 12 hours, screen time, no physical activity, not paying attention to their diet. So these are the things which actually increase all the neurological diseases. So though awareness about neurological diseases has increased in the recent past, it needs to be more stressed upon.
Awareness is the key, but with awareness comes access, and this is where I think Dr. Tripathi should come in, ma'am, because you're from AIIMS and there is of course a lot of pressure, large number of patients as compared to any other private hospital. Equitable access to resources, would you say it still remains a big issue in our country, especially when we speak of neurological disorders and of course the longer treatment, the post-care which is needed as well, ma'am?
See, there are two things. One is, the emergency care, and the other is the cold neurology care. Now, let me tell you, India is far superior in healthcare access than, say, for other countries. I know of very developed countries where the wait list to see a neurologist is 3 to 6 months. So, you can be in any developed nation in the world and you can't get access to a neurologist. Whereas in India, if a patient has a neurological disorder, they can seek an appointment simultaneously from, say, Dr. Ranjan, myself. They can get an MRI done from any nook and corner in Delhi. Whereas an MRI in developed nations may take as much as 1 to 3 months to do. So really, I do not agree, at least in the tier 1 cities, even the tier 2 cities, that access to neurological care is not there. It's there. It's only that in the resource-limited hinterlands of India, whereas the villages, the far access areas, mountainous terrain, difficult terrain, there the time-sensitive managements of neurology, which are mainly 2 in neurology, within an hour or within 3 hours, a stroke has to reach the neurologist. And within half an hour or within 5 minutes, a status epilepticus has to reach the neurologist. Now that is where, out of hospital care and emergency ambulance care comes in. This is where we differ in care. Now, in most Western scenarios, you have a doorstep call service where you can get the emergency medication in the form of intranasal midazolam or intramuscular midazolam in a status at home, or you can get a CT scan in an ambulance, or now even an ambulatory MRI in an ambulance, so that the stroke thrombolysis can be started. So what we need to have is protocols for doorstep care of emergency debilitating diseases like stroke in the form of ambulances which have CT scans and MRIs at the doorstep, as well as have treatment for the devastating high mortality or high death condition of status epilepticus. These are the 2 areas where we need to take care. Apart from that, the other area where India needs better care for neurology is rehabilitation.
Yes.
So really, after a disorder has happened, after stroke has happened, you need, repeated physiotherapy. Now, it is impossible for a stroke patient who's hemiplegic on the bed to keep coming to a faraway hospital. You need to have rehabilitation centers for good physiotherapy with physiotherapists in every few, kilometers of service, which is available easily and, scientifically.
Yes.
So these are the areas. Otherwise, I think access to neurologists, the number of neurologists is increasing. It is still in a deficit in rural areas. But in the tier 1 setting,
but is it the same for those who can afford and who can't, ma'am? Because this is where I think the issue also lies. You said that, one can get an appointment with all the esteemed panelists who have joined us on the show, but you need to have some money or an insurance to go to a private hospital. And in public, there is a lot of load. And I'll come to you. Hold that.
This is not just with neurology. This is...
And that is everywhere.
All services.
Span spectrum. Yes, I'll come to you on that point. But since you mentioned rehabilitation, I'd like to bring in Dr. Ranjan, sir. Rehabilitation is essential for brain health, isn't it, sir? A lot of focus needs to go on rehabilitation as well. What really is the current status, and where do you think we need to improve, sir?
I think the rehabilitation services are extremely poor in our country. And I would very gladly admit the fact that the rehabilitation services are not up to the mark in the private sector. They definitely need to be improved. A patient of stroke comes to me, I do a thrombectomy, I do TPA, he's got a paralysis on one side. What after that? I can't leave him alone. I have to prevent a stroke, and I have to see that this gentleman gets back to normal activities of daily living. And how can that be achieved? That can be only achieved by a structured rehabilitation program. A rehabilitation program doesn't only mean physiotherapy. You require speech therapy. You require cognitive therapy. You require Botox therapy. So I think we are still far behind, at least in the private sector, as far as rehabilitation is concerned. And I think every stroke neurologist or every neurologist who wants to practice stroke should understand that rehabilitation is an integral part of stroke treatment.
Rehabilitation, need of the hour, that's a very pertinent point which you raised, Dr. Behrani. Since we also mentioned, and you were the first one who did flag it, that there are many brain diseases, neurological diseases, which are preventable. Could you elucidate and tell us some diseases, of course, some were mentioned by Dr. Kohli, on the ones which are preventable, and any sort of lifestyle modifications, perhaps, which can help the viewers today, sir?
So nowadays, there are diseases which are emerging and which are increasing incidences in last, I would say, in last few years. Like many diseases, neurological diseases which are preventable, like stroke. If we take care of the risk factors like diabetes, hypertension, our cholesterol levels, we can get a check of smoking, alcohol intake. So in 70-80% cases, strokes are preventable. So if we check these common risk factors, which I'm just mentioning, every 6 monthly after age of 40s. So if we check these risk factors, at many instances, we can keep a check on these strokes. Also, at the same time, like common diseases which we see are the memory issues, headaches. These are very common issues which we say in our day-to-day practice. Likely said, headaches, it's our numbering are increasing day by day. If we are very engaged in our day-to-day practice, like we are getting engaged, we are doing our work 10 to 12 hours in a day. Young generations are doing work at the late night hours also. So if we keep a check on these lifestyle measures, like if we keep a check on our sleep, we take a proper sleep cycle, proper sleep at night, with good sleep hygiene. So we can keep a check on these common headaches also. Also at the same time, we have to see daily physical activity. We should keep a check on our daily routine, which we are doing, hygiene, what we are eating. We should avoid the junk foods. We should avoid any, so these simple measures, we can keep a check on these headaches also. Instead of just taking pills over our counter and taking pills, not keeping a check on our daily lifestyle. At the same time, which we are seeing nowadays are the health issues, the memory issues. So many times patient comes to our OPD saying our memory are getting weaker and weaker. And thanks to Google, every time patients Google these diseases, and every time they get they get only one disease like a dementia. So I would like to say every memory problem is not a dementia, and we can keep a check on our memory problems also. We can keep a check on our daily lifestyle. We should keep a check on our stress factors. Many times keeping these simple things on check, we can prevent such diseases, and also keep a check on these health issues also.
All right. I think the Google problem is something which many doctors have flagged. Not on this panel. You can literally take it across platforms, change the topic, and every doctor seems to have a problem with this. But Dr. Kohli, if you could come in here, sir, since we're speaking about the World Brain Health Day, the theme this year, because we have about 10 to 12 minutes remaining to close the debate, sir. The theme this year is the challenges post-pandemic, the wars, they have even mentioned climate change and a myriad of disorders. But speaking in a very Indian context, I don't know how much the Russia-Ukraine war affects us or any mindset of anyone in India, but post-pandemic era, brain health even more significant and important because, in long COVID symptoms, brain fog, deterioration, of course, of brain health was a big factor which had been highlighted, sir.
Yes, I absolutely agree with you, especially in the Indian context. What we have seen that since the young generation or the IT generation, which was working from home, they had actually lost all the physical activities. They were just sitting at one place and doing work, and less interaction, obviously, which was important. But this has led to the other diseases. Their weight have increased. They started to have more headaches, and their cholesterol levels are high. They have not been able to check the routine. Those people who are having diseases like thyroid, they have not been able to take medications or meet the consults to optimize the medication. That is one issue. The other thing which has seen very frequently is anxiety. Many people have anxiety. They're very worried about the future, how things will pan out, what will happen if the pandemic does not settle. Somebody has lost a close relative or a family member. That has also put them little back. So a lot of anxiety, headache, and stress related issues have been seen in clinical practice.
All right, and of course, those are the key markers and areas which one must take care of and flag at the earliest. Dr. Tripathi, one more question to you, and then I'll take a suggestion from everyone in the panel, ma'am. What do you think are the policy changes which you would say are needed at this time of our, we spoke of rehabilitation, the need, of course, for the last mile connectivity, which is a very pertinent point you raised. But, as someone who's associated with AIMS, what do you think is a bigger policy change which you would say is needed at this hour, ma'am? Ma'am, you're on mute, I think. Can you please unmute yourself?
I will not be in a position to comment on policy changes, but I would definitely say that for people to get their medicines and rehabilitation, the amount of taxes on devices which are used for rehabilitation, on testing devices, that needs to be reduced. So you really can't have high taxes on healthcare products, rehabilitation machines, and some of them are coming from out of India. They're not yet made in India, and hopefully they will be made in India one day. So really the taxation on healthcare products is something which is of concern. The other policy issues which is staring at our face in Delhi and no one really wants to tackle it is pollution. We know we are exposed to pollution. So I, as a doctor, previously, before say 4 or 5 years, used to tell my smoking stroke patient not to smoke. Now, I stopped telling it because all of us are smoking. All of us are exposed to this pollution. And mind you, you and me exposed to this Delhi pollution is equivalent to smoking 20 cigarettes in a day. So really, where is the policy for stopping pollution? This is really increasing brain disorders. Strokes are increasing. Dementia is increasing, and we know there is scientific evidence which is just not looked into that pollution increases strokes and dementia and heart attacks. So policy issues on pollution is very important. What is heartening is the Swachh Bharat campaign, because ever since the Swachh Bharat campaign started and the toilets and the toilet hygiene has improved, the amount of neurocysticercosis, which is a worm in the brain which causes seizures, has reduced. So people need to be aware of clean water, clean air, and clean food without the bad oils. Unfortunately, oil being so expensive, people consume the cheapest oil, which is a palm oil, or even, the saturated fats. Now they're going to cause strokes. So you need to have policy issues that you can get clean water, clean air, and clean food with clean oils so that your brain health improves. So I think that is really required. And
Okay, it's a
That
very
is
important
something.
point you raise, and issues which would have certainly evaded us. I mean, pollution, in fact, even the quality of oil, that's the last thing which even came to my mind, and I barely expected it would crop up in this discussion. Very important point, ma'am. We have about 3 to 4 minutes remaining to end this discussion. I'd just like to take a closing comment from all the doctors, starting with Dr. Ranjan. Any suggestions for the people watching the show? Dr. Ranjan, first you.
My suggestions are very straightforward. 22nd to 28th of this month is the Brain Week by the World Federation of Neurology. I would only advise all of you who are listening to this program, please look after your brain. The brain will look after you. What do? Very simple. Avoid pollution, avoid fatty foods, look after your modifiable risk factors of stroke, do regular exercise, eat good diet, have antioxidant, you will prevent brain disease.
Personal, Dr. Behrani, you?
Yeah. So my suggestion to all is keep a good check on your health. Try to visit the hospitals, not in emergencies, but in routine also. We should keep a good check on our health. We should give good. We should have a
Okay,
exercises. We should have a healthy diet. Emergencies only we can if we could keep a check on all these things.
All right, Dr. Kohli, any suggestions as we last comment?
Like in any emergencies, stroke, which is a time-sensitive emergency, try to reach the hospital stroke ready center as early as possible. Try to comply with the medications which a stroke patient is already taking. Don't suddenly stop them. Keep a check on your blood pressure and sugar. And if you are more than 40 and if you have a history of a young stroke or a young heart attack in the family, then get a regular and a periodic checkup. So if you have a tendency to have those things, those diseases, they can be picked up early.
All right. Dr. Tripathi, last but not the least, any suggestion, ma'am?
I would like to say we have just one brain. And really, one should be aware as a people, what is the function of the brain? The brain helps me speak. The brain helps me see. The brain helps me hear. The brain helps me think, plan, and memorize. Now, and move around, the motor functions. So anything which impacts the brain, a bad lifestyle, sedentary lifestyle, pollution, smoking, alcohol, obesity impacts my brain. Not wearing a helmet and having a head injury impacts my brain. I, as an individual, have a responsibility to look after my brain. And let us start with myself today. Thank you.
I think those are very pertinent, very relevant suggestions. Of course, it's been a very informative session. Most, of health reporters, everyone's talking of, say, monkeypox and COVID these days, but we did try to touch upon an offbeat subject and hope we've been able to pass on some information to our viewers. For now, I'd like to thank all of you for taking out time from your busy schedules to speak to us here on NewsX.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.